Good morning, Maryland. I'm Christian Schaefer. Thanks so much for joining us on this day of answers here on the WMAR2 News Facebook page. I'm joined by Dr. Sidra Iftikhar from GBMC. She's a resident physician there. And you see a lot of patients, Doctor, I know, especially this time of year with flu season. Technically, Doctor, are we into the flu season already, or is this kind of early to be talking about that?
No, hi, good morning, everyone. So thank you for having me. So it's the right time to get yourself vaccinated because we are almost you can say have entered because tomorrow will be 1st October. So not much a difference right now. Yep. So this is flu season.
Yeah, and I imagine, Doctor, that every year that you recommend that people would get the flu vaccine. There are still some people who choose not to get it, but I'm assuming that this year it's even more important.
So I would definitely say that very much clear and loud that if not any year, but this year, you should be definitely getting your flu vaccines. It's very important to keep people away from ERs and ICUs and to have that reserve for the people who have COVID and not to have that burden on the healthcare system. So people should definitely get a flu vaccine, if not any year, but this year.
So it's interesting that you mentioned that too, Doctor, because at the beginning of the pandemic, maybe 6 months ago, people were comparing it with the flu and making those types of comparisons. We didn't know much about the coronavirus at that time. But it's true that every year people do have to go to the ER and sometimes use hospital resources for a regular case of the seasonal flu. Sometimes the flu can be very serious.
Exactly, it can be. So it depends upon your own immune system, how good immunity level is yours. So that depends upon so that actually gauge your symptoms and the severity of the disease. So if you have a good immunity system, you will have the milder symptoms. And if you are like older people with chronic conditions, comorbidities, they tend to have a severe course of disease. And the vaccination actually prevents you in a good manner from the severe form of flu.
I went with my daughter and got the flu vaccine last week, Doctor. So I just want to let you know we're good.
Yeah, I was in clinic last week as well. So we have started giving flu shots to all our patients. Yeah.
I read somewhere this week that there has been a bit of a demand and that some people may experience a shortage in some places of a vaccine. But a lot of times you make an appointment to go get it. So I would imagine that if you make an appointment, they're going to set it up to where you know you can get one. Have you heard about there being a shortage and any concerns about that here early in the flu season?
So far, so every season there are some lapses between the supply and demand, but I would say not really any major thing, any concern right now regarding the shortage. And you can get from your primary cares, the ID physicians, and also in pharmacies, marketplaces, wherever it is available, you should get your flu shots. And I hope it's not going to be a supply demand issue this year. Hopefully.
Yep. I want to thank our viewers again for watching us here on the WMAR2 News Facebook page on this day of answers about the flu, entering into what could be a difficult flu season, given that the coronavirus pandemic is still going on out there. Talking with Dr. Sidra Iftikhar from GBMC, hoping to give people more information about getting their flu shots. If you have any questions, feel free to write in on the Facebook page. We'll get those answered as best we can here this year. And one question, Doctor, that we get a lot is about the vaccine itself, because sometimes people get the vaccine, or they have in the past, and they start to feel some symptoms and they wonder if they've given themselves the flu inadvertently. Can you talk a little bit about that process?
So first thing I would like to clear here is that vaccine doesn't give you flu. That's for sure. It's usually an attenuated form of virus or from some part of the virus which is in the vaccine, and it cannot give you flu. But the thing is that if you have acquired from from somebody else flu before getting a vaccine, and you get the symptoms in between, because your immune system actually builds up around 2 weeks after you are vaccinated. So if you get symptoms in between that period, that means that you probably had acquired prior to the vaccination, and you are having those symptoms, not because you got the vaccine. So that you should have that thing clear in your mind. And also other things that even after that, if you get flu, so vaccine is usually it covers 3 to 4 strains of influenza virus, which are they are studied prior to the season, at least 6-7 months, and they are people who make vaccines, they go for the most common ones, or which they think will be the common ones during the season. But if it does miss the other minor ones, and there are like a lot many strains of influenza virus, it's notorious for its mutations it undergoes. So even during while the vaccine is being made, so you can get infected by any of those viruses, and then you can get flu. So it's not 100% effective, but like seatbelts are not 100% effective. Helmets aren't either. So you haven't stopped wearing them. So it doesn't mean that you should stop getting vaccinations.
And you mentioned that 2-week time period
Yep.
that it takes for it to really become effective within your body. So it makes sense to try to get it earlier in the flu season.
Definitely. And this time, I think you should definitely go for the earlier one, because this is you should have your vaccination done to have a better match between the strains in the season and strains inside the vaccination. So I would go for getting earlier vaccination this year.
And just to be clear, because we've been dealing with the pandemic now for so many months,
Exactly.
that is a completely separate virus from the flu virus, correct? That's not
Yes.
completely not the same thing.
No, it's a different virus. Yes.
So in theory, it could be possible for someone to get both of them. Is that something that people have really even thought about, or maybe even seen yet at this point?
Exactly. You can have co-infections. You can have co-infections with two viruses, and a virus and a bacteria. So that's the reason you should try to protect you from the one for which we have a preventive measure. For corona, we don't have any yet. So it's better to be protected at least against one of them. So yeah, you can have co-infections.
We got a question in from one of our viewers. Brenda is asking about the flu vaccine for people who have diabetes.
Yes.
Is it something that they should get as well?
Of course. So diabetes is one of the comorbidities. So that puts you at a higher risk of getting severe form of flu and also getting other viral infections. So definitely they should get their vaccinations. So vaccination doesn't really cater about the like comorbidities. It's dependent upon the age. 65 and less, like 6 months to 64 years of age, you get the standard dose, and 65 and above, you get the higher dose. That's the differentiation, not like diabetes or hypertension.
And Lisa is asking if it's best to wait longer to get it because maybe she feels the vaccine only lasts, maybe not through to the end of flu season. Mm-hmm. She's wondering if she should wait a while to get it, or if it's okay to go ahead and get it as soon as possible.
So I would say, based on my discussion with our ID physicians here, that it's better this year to get earlier, because then you will have a better match with the strains, and also you will have a better coverage, and that will keep you away from ERs during the season. And we have pandemic right now. We don't know what will be 6 months after. We should base our decision what is happening right now. So we should get vaccination as early as possible. Yeah.
Yeah, doctor, I've never gotten the FluMist. I know that it's out there. I feel that maybe I remember in some years it's not available. Is it available this year? And is that the FluMist, which is, I believe, inhaled through your nose? Is that a decent option for some people?
So the flu mist and vaccine, the difference between is the form of virus component which is used. In the mist, you use like a live attenuated one. That's why it's like used as a mist and as like a nasal spray. It's definitely not recommended with ones who have lower immunity, have other comorbidities in pregnant women, and like all these criteria, groups should never get mist, like children, pregnant women, and comorbid patients. Other can get it. It may be available as well, but I think it's better to go for the short because that has inactivated form of virus. So like very low risk of you getting anything bad from the vaccine.
How about women who are pregnant? Should they?
They should never go for the mist because it has a live attenuated one, and like pregnant women should not be getting anything which has any form of live form of component of virus in the vaccine.
So they should, but should they get the shot though?
Definitely, they should. There are like this is one of those few vaccines which is definitely recommended in pregnancy. So, yeah.
Interesting. Talking with Dr. Cedar Iftikhar from GBMC here on our Day of Answers. We're so happy you could join us today because I know a lot of people are concerned about what this winter is going to look like. I mean, some years the flu season is very difficult with kids in school, with people trying to go to work. And when you actually contract the flu, you can be down. Some people maybe confuse it with the common cold. the flu can be very serious. It can really make you feel bad for a long period of time.
Yep. Yep. I mean, that's usually when we are asked that how we should we differentiate between common cold and flu. It's very easy. Like common cold is usually runny nose and like sore throat, not much of a fever or other symptoms. But when you have actual flu, influenza virus infection, you tend to have more fevers, more body aches. We call them myalgias, and it's like a little bit severe form of cold. So you should that's the way you can differentiate between a common cold and influenza virus infection.
And now, after all this time, people hear about every day on the news this novel coronavirus. So I'm wondering if people start to feel some of those symptoms, if you think they should go ahead and get tested, for the flu, but maybe also get one of the coronavirus tests that are available in different places as well.
So yeah, I would say keeping in mind the pandemic which we are right now, so it's there are a high likelihood that in fact I would say people who are going to come in ER with respiratory complaints, they would get tested for COVID. So that is a reason to keep people with milder form of symptoms outside ER, because it will be an extra burden on the system for COVID testing. And then, you end up getting the false positive and false negatives that talk about that. So, and for you to differentiate between corona and influenza, I know they're both, they're your respiratory systems. So it's hard. But then in corona, we have seen other systems being affected, like diarrhea and loss of taste and smell, which is not really seen in influenza virus. And then, of course, you yourself, you can gauge that whether you were exposed to somebody with COVID or not. So yeah, those are the lines which I would say you can help yourself differentiate between it.
Yeah, those are going to be some challenges going here deeper into the fall. Got a question from Niaz, and you were talking a little bit about differentiating between the cold, a common cold, and the flu. But is it difficult for at what point should you go and see a doctor? At what point should you call the doctor and feel like, hey, my symptoms are starting to get a little more serious now? When do you make that call?
That's one of the dilemma we always face, and I keep on telling my patients as well. So common cold is like stuffy nose and sore throat, more of that sort, and your home remedies should be able to help you with it. But if you start developing a fever and fatigue, malaise, and body aches, then that should be a red flag for you to say, okay, now I probably have flu virus in my body instead of having common cold. Yeah, that's the way you differentiate between these two things.
Some of the questions we're getting, Doctor, are regarding people who have other medical conditions. Where there's one here from Deborah, has severe allergies along with COPD. And so she's wondering if she should get the shot because she's probably concerned about those symptoms that some people start to feel after they get it, and whether they might impact the conditions that she lives with every day.
I totally understand her concern, and it's very right to thinking about when you have allergies and all that. So it's very it has been a myth that people who have egg allergies should not get it. So if you go on even on CDC guidelines, it says if you have egg allergies, even it's in a severe form, you should definitely even then get flu shots. You might end up getting in an inpatient setting, so if they can gauge you or if you're going to have any of the symptoms of severe anaphylactic reaction. And other allergies really don't have any interaction with the flu shot. So that's one of our questions. Other things, COPD. For COPDers or any other respiratory complaints, actually that warrants you to be more inclined towards getting a flu shot, because because your chronic conditions, they actually get aggravated when you are having flu virus in your body. So it's for her severe allergies, I would say there is no need to worry about that. For her COPD, she should be definitely going for a flu shot to have not any exacerbation of COPD.
So more reason to get it, not less.
Your respiratory system is already compromised. You should not let anything else invade it. So yeah.
Interesting. Doctor, I'm wondering, I'm kind of hoping actually that with more people wearing masks these days and more people washing their hands more often maybe than they have in the past, given that the pandemic's been going on, could that potentially lead to a less serious flu season this year? Because sometimes the flu can be transmitted in a similar way.
So actually, I would say that will that will help us, like the social distancing, if we are observing it very properly, and the masks and the hand hygiene. That should definitely, because it's also another virus which is spread through droplet infection, just like coronavirus. So yeah, if people are observing them, it can be like a twofold protection against both the viruses.
But still get that flu shot.
Of course. I mean, if you have what we are thinking, what we are worried about right now is corona. We don't have a vaccine for it. But if we have a vaccine for other one, why not to get that one and be safe?
So would you recommend people contact their family physician to get the shot, or would you think it's easier just to go to the local pharmacy and get it that way?
So I would say, from wherever you think you can have yourself minimize your exposure to like COVID or suspected COVID patients or things like that, you should get your vaccination from there. If your primary care, they're following the rules and regulations in the clinics, like distancing and more staff, you should go there. And if you're able to get from any pharmacy outside, you should definitely get from there. I mean, anywhere where you feel comfortable and more convenient.
Is GBMC going to go ahead and offer flu vaccine this year?
Yes, so we are giving them more in our clinics, the primary care physicians, and also we are working on the drive-through flu vaccines as well. So yep.
Dr. Iftikhar, do you have anything else you want to say to people who are watching the Facebook Live discussion this morning, just about the importance of getting that flu shot, particularly this year?
Definitely. I'll again repeat myself that if any year, this year is the one you should definitely keep yourself protected against at least influenza virus, for which we have a preventive measure, and also to keep yourself away from the hospitals and ERs, as I said before as well. And if you have one thing I would like to add here, and in fact two things, that if you have any acute illness of COVID going on, or you're suspected COVID patient, then you should wait for your acute illness to subside and then return back to get your flu vaccine. That's one thing. And the other thing is that, too, as you asked from where they can get it, if you go on CDC website, there is a map, health map, which you can use to locate a place nearest to you for flu vaccine. So that's another helpful tool for you.
Okay, it's important every year, but especially this year.
Exactly.
Dr. Cedar Iftikhar from GBMC, thanks so much for joining us today. A lot of good information. And this interview stays up on the Facebook page, by the way, if people want to go back and watch it again. But again, Dr. Iftikhar, thanks so much for joining us this morning.
You're welcome. It was nice having you. Thank you.
Thank you.